अच्छा हाँ बिल्कुल.
Left.
ये वाला sorry.
Yes.
Okay. ये मेरे ख्याल से आ रहा है. चलें ये ठीक है जनाब.
You can start now, please.
Okay. All right. Bismillahirrahmanirrahim. Now we are going to talk about a very important topic, and that is physical and sexual abuse in women. We are going to emphasize a little bit more on the domestic violence because that's the abuse you're going to see most in your clinical lives. And in the end, we are also going to talk a little bit about this phenomena or this abuse in contest with the pandemic that we are facing. Okay, what is a physical violence? Now, this is again a term that we have to take in contest with the culture. हो सकता है कि my definition of physical violence may be different from the definition of someone who has been growing in an environment of physical violence, or someone who feels that unless you're really badly beaten, it is not even a physical violence. So here, the behavior that even a threaten, attempt, or actual inflict of physical harm is considered a violence. So even abusive language, a language that is threatening, for example, a certain language which you'll use with your colleagues or a friend can become a very threatening language when is being used when the other person is a more less of a controlling position. For example, a colleague, if you're a supervisor, then the person who is your supervisee may take that threat in a very different way. Similarly, in household where the control is very skewed, where a certain member of the family has much more control. They have control over food, they have control over shelter. Their threat can be can have different feelings, or it can be perceived in a different way as that of two children playing together. So that is is what in general is a definition of physical violence. Now let's come to the what WHO considered a physical violence, and that is any act to obtain unwanted sexual or even a comment which is made, any advances, or something which can be used as a coercion, as for example, someone is not given certain food, or someone is not allowed a promotion, or some favors are given. These are all considered the violent acts of violence, and this can be at home, at work, but not limited. So it can be while people are commuting, you're in a shopping mall, anything that is considered that can, and the relationship also can be any. You cannot just say that this individual was related to, or it's all right if they say this like this and other people cannot. No, it's not like that. So this is very important, that this is regardless of the relationship, and not limited to just home and work. Okay. So when we look at the act of physical violence, be it legal, be it you as a medical professional, and look, you are going to hear a lot of stories which people will not probably tell anyone else, not even the legal personnel, a police officer, because people tend, and they must, we the medical caregiver, and especially the physicians, should hold ourselves to the level of ethics that we will keep confidentiality. Whatever we'll do will be the interest of our patients. So they will tell you a lot more about their lives than they would probably not even tell their own family. So here are or you're going to do something about it. For example, if a patient comes and says that, my husband has, or my, somebody that I know has actually threatened me with a gun, what are you going to do now? And this is where you as a physician have this burden of decision to decide what are you going to do. Is a life, you deem the life is in danger, and proper actions need to be taken. Or the lighter side is if somebody has this problem with the aggressive attitude or throwing things around, and then maybe counseling is needed, and that level of intervention is needed. Okay. The facts and figures are very staggering, and domestic violence, like I said, I'm going to talk a little bit more about, because you're going to hear a lot about it. And the fact is that most of it goes unrecorded, and the implications and the complications that comes out of it are several: physical, social, and psychological. So you can see that WHO reports that proportion of women who have ever experienced physical or sexual or both by intimate partner, which in our country is mostly the individual she's married to, or other, usually male members of the household, range from 15 to 17%, and in majority of cultures between 29 to 62%. And it varies from household to household, true, but it is cultural. It is found in every society, developed, underdeveloped, uneducated, it is there. So just to stereotype people is not always the best thing. You have to keep your eyes open and look at it more objectively, because it is there. And if one individual in a house, in a society is suffering, then for that individual it's 100%. Okay, now here we are looking at the side effects that can happen, the complications, sorry, because of the violence, and in the reproductive health. Increased risk of acquiring STDs. Now, usually the spouse who's involved in it, or the individual in that culture where abuse and abusing is part of it, there's very little fidelity, and sexual promiscuity is present. And also women who go on and have relationship and risk, put themselves in risk of STDs, usually come from, there's a big majority of them who come from household where they're being abused. So it is not that they are vulnerable, but they are their spouses, because they are violating their rights. So they are more likely to have unprotected sex, and they can, and these women are usually more at risk of STDs. There is usually very little say of these women in how they want to live their life. If they are at this point, if they feel strong enough, for example, to take care of children, in our culture, elderly parents, run the household, so they have no say in that. And that's why all the complications, now that you have finished or in the middle of your OB-GYN rotation, you can think of all the complications that can happen in an unplanned pregnancy, and this violence leads to that. There are also twice the risk of miscarriage and they have 4 times the risk of having a baby that is below their average weight, which is quite, it doesn't take a rocket science to explain that somebody whose right is being violated. Of course, she is not going to have this level of authority of on an environment to make sure that, she's eating well and taking care of herself. And then there are all other issues. In human psychology also plays a role in that. Violence also accounts for sizable portion of maternal deaths. Now, it doesn't just stop with the woman. The children who are growing up in these households are quite likely to have are quite likely to have all these complications. They have never learned self-control. They have never seen the person of even a minor level of authority showing what the self-control is like or self-discipline is like. And they have seen the person that they liked, a mother is almost a part of the child. To see a mother being violated, it is almost like a PTSD. And if you come to our psych rotation, you will learn about it. So it is, for a child, it is almost like somebody they know, somebody they love, his physical integrity is being violated. And they develop what is cause of a post-traumatic stress disorder, in which even any reminder of a violence is considered a threat. And these are the people you will see that, they're going around toting guns and killing people because they think that this individual may be threatening, and because they have a small gesture and they will really blow it out of the proportion. Maybe that's what, this is what happens. They also have increased suicidality. Like they will either be thinking about suicide, or they may actually go and commit suicide, as opposed to children who are brought up with a childhood which is not, which does not have this violence in it. They're also more likely to use drugs, and more likely, and eventually they become the perpetrators. They begin by looking at it, they learn, it becomes part of their psyche, and they eventually become the perpetrator of this abuse. And in later life, they become abusers themselves. So what needs to be done about it? Look, the effective response to the violence is multi-sectorial, which means your law is involved, communities are involved, and of course, a medical personnel. And all of them need to be educated and know what physical violence is and how to deal with that. For example, one individual who is coming from a legal personnel who's coming from a household where physical violence has happened, and they do not even know that it is wrong, or there are other places that it is legally not acceptable, but socially they have actually seen it. So a child who has grown up in a household where domestic violence is happening will have to be actually educated, and it will actually have to be taught that what is the where it is physical violence, what are the rights of the individual, and they will be able to then do something about it. Sending, for example, somebody who has received a bad abuse, sending them back is not a decision that can be taken lightly. For example, if you go back, I gave you these lists of, I can't go back now, we want to hurry up, we've lost some time here. So we can, if it was just a slap, or I won't use the word just a slap, if you look at from the psychologist or psychiatrist point of view, it's much bigger than that. It's usually a tip of the iceberg, but how bad the threat is. and just sending them back without doing anything about it. Least of the physical violence should involve at least a psychologist, at least some counseling before we feel that everything is okay. Because as I said, the physical violence is just the tip of the iceberg. There's a lot going on there inside that household that needs to be taken care of. Now, this is where the health sector comes in. We are at a privileged position. We can, identify abuse much early. People trust the physician, and they must. Physicians, doctors, they must. And if they're not, then there is something we need to change about ourselves, learn what medical ethics are. And if that becomes part of your, what you take in this role of physician doctor, if they know that this individual, if the patient has this confidence, and they should have this confidence, that they will bring in their life stories and tell you about it. And doctors are able to identify this abuse much earlier. We can provide them with the necessary treatment, the physical treatment, of course, but also the treatment so that this doesn't happen again, the social treatment, and or at least direct them where it is needed. And then if it is something more severe, a general physician can always direct them to appropriate health care. In 2012, Sustainable Development Goals were set. And these are very important because of these, the fifth goal was gender equality. And they found out that in the cultures where violence and domestic violence, for example, is happening a lot, there is no equality. There is the power is more in the hands of one member of the household, which is usually the male member. And they found out that if you want to have a world which is peaceful, prosperous, and sustainable, where it is not rags to riches. One day there is war, one day there's famine, markets are crashing. If there is this sustainable, prosperous world, we need to have a gender equality. Though we say it's a fundamental right, but we need it for the survival of the human race. And this is the fifth goal. And what has happened with COVID-19? And it has been, UN Women have, and this is a UN General Secretary who said that the gains that we got in gender equalities and their rights are in danger of being rolled back. And why is this? This is a known fact that the COVID-19 response has led to increase in violence against women and children. And why has that happened? There are several reasons. One, the work of women has increased. They are caretakers. They are now, many of them are in frontline workers. They are have to take care of their household. Many of the women were working from home. For example, in Pakistan, they were cooking or they were stitching, and a lot of small cottage industry, if you may, it was women who was, it was giving them some empowerment. And that has to be stopped. And now, in this small household, you have a woman, आपके पास आपके वो बच्चे भी हैं, उसको look after भी करना है, and the abuser and the abused are living in the same house in a very small space. Before that, at least they could go out, and that is not happening. So this abuse against the women is increasing, and it is not just increasing, in a way that it is already recorded. So from the way we see it, this pandemic is going to stay with us. The way we see it, the circumstances where an abuser, a drug addict, spouse, or a family member is in very close contact with the people he was abusing, they cannot even get out of that situation because they're stuck together. And many of the